Still on the topic of identifying health goals, the next topic will talk about risk factors. Still talking about the three sides of your triangle. We all know that your health goal should include all sides of your triangle. So when we talk about risk factors, there are two types of risk factors that we will talk about. That's uncontrollable risk factors and controllable risk factors. Just to review, the three sides of the health triangle, your triangle that you should remember all year, are physical, emotional, and mental, and then lastly, social. So, your I can statements. It's only one. I can distinguish between controllable risk factors and uncontrollable risk factors. In the past, when people think about health, they think healthy is just, oh, I'm not sick. But being sick has nothing to do with being healthy. So in the past, a lot of people consider themselves healthy if they didn't have an infectious disease. And an infectious disease is basically a disease caused by bacteria, or it can go from person to person. So an example of that is the flu. Today, through a lot of research, lifestyle diseases contribute to a lot of health problems. And lifestyle diseases are more so of unhealthy behaviors. So that some forms of that are diabetes and cancer. Not all cancers are, uncontrollable, but some are. So that's why it says some forms of cancer. It's mainly made off the choices you make about your health. So we're going to distinguish between the two. So we got uncontrollable and we have controllable risk factors. So, what exactly is a risk factor? Risk factors. That's what this definition is. Anything that increases the likelihood of injury, disease, or other health problems. So that's what a risk factor is. So you have controllable risk factors, things that you can control. You have uncontrollable. Controllable are factors that you can do something about. Examples of that: smoking, physical activity, diet, and weight issues. And then you have uncontrollable. These are factors that you cannot change. That's your age, that's your race, gender, heredity. So to go into that, risk factors are anything that increases the likelihood of injury, disease, or other health factors. So when you think about controllable, when we're talking about smoking, lung cancer, remember we said some forms of cancer can be controlled. Lung cancer is one that can be controlled. Smoking increases lung cancer. Diet, weight, physical activity, that can go with diabetes. All things like that, things that you control, your weight, your diet, what you eat, that contributes to things like diabetes and heart disease. Some uncontrollable risk factors. And I do want to point this out. There are some uncontrollable risk factors that can be, factored with controllable risk factors. Although age plays a part with heart disease, it's still a chance that you can stop it. The older you get, the more likely you can develop heart disease. But as you're getting older, you can prepare yourself for that. That's managing your weight, diet, physical activity, and not smoking. But as you're getting older, that's just something we can't control. You just have a possibility of developing, heart disease or anything like that. Your race. There's a lot of things that may be African Americans. Like a lot of African Americans have high blood pressure. That's just something you cannot control. Gender. A lot of males, they're more typical with colon cancer. And then females, breast cancer. So that's something you cannot control. So when we think about risk factors, we have to start thinking about things that we can control and what we can't control. So that's a big part of health too. So anything that you can change, I would try to change it, which is smoking, do not smoke, weight, get at your healthy weight, diet, eat right, physical activity, at least exercise 3 to 5 times a week. Those things you should focus on because it can prevent a lot of health issues that are going on in America. Think about those things.